Well, many patients have been fearful going to the hospital for fear of exposure to COVID. So is that really a valid fear? I am joined now by Dr. Thomas Nowicki of Emergency Medicine at Hartford Hospital. Thank you so much for being with us, doctor.
Thank you for having me.
Is it safe to go to the ER, and do you see patients coming back?
It is safe to come back to the emergency department, and we have seen a decrease in patient volume and visits, which as an emergency physician I'd like to say concerns me. We're fearful and concerned that folks that require emergent care are not necessarily seeking it. So we would like to share that it is now safe to come back to the emergency department for any emergency.
Yeah, and you hear, I'm a mama too, you keep hearing this all throughout the summer. Kids, don't hurt yourself. It's not a good time to go to the hospital. But you're saying that's really not necessarily, that's not true. And as the summer months happen and we see injuries, people should feel comfortable going to the ER?
Right, yeah. As a matter of fact, I think an early message we had was with respect to concern for what the volume might look like going into this pandemic. So we asked the community to not come if you had a non-emergent concern, but now we're past that. We've put so many measures into place to make sure that the hospital and emergency department are safe places. It is the time to come back. If you have an emergency, please do come visit and seek that care. I'm very concerned that some folks are not doing that, and conditions that could be treated and folks that we could help are just not coming in.
And there's definitely a risk to that. And just tell folks at home, how are the patients separated from any possible COVID positive patients?
From the point of entry, we have systems in place to be able to screen and identify those patients that are either known or at risk for COVID. And we have many measures, including some of the common things that we all do in the community, such as wearing masks and social distancing, so that those patients are separated and cohorted and placed into a place where they're safe, our patients are safe, and our staff are safe as well.
Dr. Nowicki, thank you so much for sharing some time with us.
You're welcome. Have a good day.